Dr. Kitakule's confident calmness has brought our community together at IMC. He has been a physician that we've trusted through this COVID pandemic. He has been our right-hand physician as far as pulmonology and lung specialty, and has truly brought us through this pandemic together. Instead of falling apart, he has kept us together as a hospital.
Dr. Kitakule has been a part of public service announcements that have aired on the local television stations to promote awareness about COVID-19 and how to stop the spread, and also to promote the community to wear masks to reduce the spread of COVID.
It kind of came natural to me because I'm the pulmonologist here in town. I'm the only one. And the disease is a disease mainly of the lungs and involves the intensive care unit. And so it was in a way self-interest for me to get involved, because I knew if we don't do it right, I'll be in the middle of it. We kind of got together as a team and kind of planned ahead, used some information from what other people had gone through, and were able to really kind of stay ahead. It's interesting. It was actually surprising for such a small facility that we're able to put in place things that were able to protect our patients and protect our staff.
And one of the main things that he has brought to the table for us has been the Mayo Clinic. He has innovated different procedures for patients to improve through the Mayo Clinic that we've never had an opportunity to participate with before. So that was something different for us, and it was a learning opportunity to grow as a hospital.
At the beginning, we were giving more of the infusion than bigger hospitals. Much bigger hospitals than ours, but that's because we planned ahead and we had a good pharmacist who knows how to get all the medications in time. It's actually amazing how he did it.
It feels great to be a part of such an accomplished team. Dr. Kitakule has kept up with all the latest research for COVID-19 treatments throughout the pandemic. He was very knowledgeable and very compassionate. Always making sure to keep the family members of these patients up to date whenever they were unable to see their family members in the hospital for sometimes 2 months at a time. He would round on the patients sometimes 4 or 5 times a day. He was very involved in their care. He was very compassionate. I don't think he had a day off throughout the peak of the pandemic. And he was always sure to make sure that we as the nurses, that we were okay also, and that we knew how to treat these patients and to feel confident doing so.
Our nurses have done an amazing job. They use the resources that they have to provide the best care that they can to the patients. They're on top of things. I'm just going to give you an example of a nurse that made me cry. This nurse was in the room holding the hand of these patients as we were planning to put the patient on a ventilator. Everybody was out of the room and the nurse was the only one there. I was really touched that in this patient's loneliness, where this is end of life and this nurse is holding her hand, just the two of them, as we're getting everything together to make sure that the patient can be safely put on the ventilator without exposing anybody else. And as I was driving back home, I was crying. I was really crying in my truck, and I said, this is what nursing means. I'm really so proud of the nurses at our facility. They've done an amazing job.
Dr. Kitakule showed us his expertise in a way that we saw from no other physician. He truly stood out when it came to a viral pandemic that no one had ever seen before. You know, he truly knew what he was doing when it came to saving lives.
My belief has always been is that we should be able to provide excellent care in our community so that somebody doesn't have to go far. You know, this is our community. So you want to be able to be confident that if Acadian gets me to Iberia Medical in 5 minutes, there will be somebody there who is going to do everything in their powers to defend my life. That we can provide compassionate care, good care to our patients, and leave everything else to God. A lot of people look at small facilities and say it cannot be done there, it cannot be done there. Yes, a lot of good things happen at Iberia Medical Center. I wish people knew more about that. We have amazing people who love our community because they live here, many of them. They take care of their grandparents, their uncles, you know, so they are looking out for them, and that's their job. They wake up in the morning and come and say, let's do our best to defend life, to make sure that we provide compassionate care. And I think we have a big chance to continue growing as a facility in order to serve our community.